Good afternoon. Thanks for joining the town hall. We'll get started in a minute. Hello and Happy New Year. Welcome to the COVID-19 Response Town Hall. It's my pleasure to introduce UCSF Chancellor Sam Hoggett.
Thank you, Lisa, and good afternoon, everyone. Thank you for joining us at this town hall this afternoon, our very first in 2021. As we gather today, I want to briefly reflect on the unforgettable events that transpired this week in Washington, D.C. The horrifying siege at our nation's capital by groups aiming to contest the lawful results of the presidential election. This incident strikes at the very heart of our democracy. It reminds us that the peaceful transfer of power, a cornerstone of our nation for more than 2 centuries, should not be taken for granted. It demonstrates how the words and actions of leaders can either incite or inspire, or divide, or unite. It underscores the important need for an informed and educated society that relies on facts. And it shows, unfortunately, the double standard in security response to the mostly white rioters, a stark difference between how people of color have been treated. Eventually, as you know, the will of the people prevailed. Congress confirmed the election, and President Joseph Biden and Vice President Kamala Harris will take up office on January the 20th. In the days ahead, I urge us to recommit ourselves to our shared mission and values, treating everyone with dignity and respect, even when we disagree, and working towards a brighter future, one that not only advances health, but also truth, justice, equity, and inclusion. Here at UCSF, I'm pleased to say that in this new year, we are making great progress on vaccinations. You will hear details about the vaccination program soon, but I want to emphasize that we intend to vaccinate all members of the UCSF community who wish to be vaccinated as supplies become available in the coming months. As you know, we are prioritizing our vaccination program to first vaccinate those who are working on the clinical front lines at the highest risk for exposure to the virus. During the next round of vaccinations, we will begin vaccinating other employees and learners whose responsibility require them to work on site, and then employees who are currently working remotely, beginning with those aged 75 and older. Simultaneously, we will also begin the enormous task of vaccinating the patients who consider UCSF Health their home. I am very grateful to all of those who are working and volunteering to get as many people immunized as soon as possible. We are hopeful that as more people become vaccinated, we can emerge from this public health crisis and be better able to confront the next one. Without question, the recent proactive Bay Area County directives have helped control new transmissions. However, we anticipate experiencing a continued surge in the coming weeks following the holidays. For now, the research community remains at interim reduced capacity until January 19th. I acknowledge that this is a significant challenge to our world-class basic and clinical researchers, so we will continue to monitor the COVID-19 infection rates, both on campus and in the communities, our hospital census, our PPE available, and infections at our UCSF facilities, amongst other metrics to determine when we can further densify the research community. We will update you all before January 19th when we have determined that it is safe to increase the research density. There is no doubt that the human toll of the coronavirus has been staggering. More than 700 members of our own UCSF community have contracted the virus, with 153 active cases in the last 14 days. With December alone accounting for more than 40% of all of our confirmed cases within the UCSF community. This increase reflects the post-Thanksgiving surge of cases that were mostly community acquired and some while at work. We all have the ongoing responsibility to ensure that we have a safe working environment. We need your ongoing cooperation to continue following public health orders and UCSF policies. You will hear more from Ralph Gonzalez about COVID cases among our faculty, staff, and students shortly, but I want to acknowledge the sad news that 2 members of our UCSF community passed away last month from COVID-19. Both of these employees contracted the virus through community transmission. Neither had patient care responsibilities, but both served the university with great distinction. We are grateful for the university service and send our sincere condolences to their family, friends, and colleagues. Let's just pause for a moment now to remember and respect these UCSF colleagues and others who have been impacted by this horrendous pandemic. Thank you. I encourage those of you who can find a way to help those in need, whether it is volunteering at a food bank or donating to charities to support those hardest hit. Now, as we work towards vaccinating our entire UCSF community, all of us, including those who have been vaccinated, must continue to wear masks, physically distance, frequently wash hands, wear eye protection as required in the clinical setting, and avoid unnecessary travel and gatherings. And please continue to complete the mandatory health screenings before coming to campus. In closing, I want to express my belief that we can and will overcome this challenging period in our history, and that through it all, we will be proud of our role caring for our patients and the communities who depend on us. I thank you as we begin 2021, just as I did throughout 2020, for thanking you for all that you do, both here at UCSF and in your communities. I'm now going to turn it over to the UCSF vaccination distribution team for an update on our vaccination program. This will be given by Gina Intinarelli, Vice President of Population Health Management at UCSF Health, Susan Smith, Chief Faculty Practices Officer, UCSF Health, and Desi Cotis, Chief Pharmacy Executive, UCSF Health. Gina, I turn it over to you.
Good afternoon, everyone. Let me just bring up my slides. Okay, our team is very excited to bring you updates on our vaccination progress, and we want to acknowledge and thank the entire UCSF community for your support and patience as we put into place an unprecedented amount of vaccinations that we have never had to do before. So our agenda will be just to go over our vaccine deployment progress, some scheduling tips, and we'll show you why this is important, our projections on our vaccination deployment and when we think that we will have all of our first group of vaccinations complete, our vaccine supply update, some criteria for phasing beyond 1A, and then a little bit more about our vaccination centers. So our vaccination progress to date, as you can see, began on December 16th. We started vaccinating within 4 hours of receiving the vaccine. And to date, we have delivered over 12,000 vaccination doses, and we began second doses a few days ago, and we have delivered 429 second doses. So thank you for all of you who have made this a really pleasurable process. There's a lot of happiness down in the vaccination center. Our vaccine dashboard is live and we encourage you to do it. It reflects both East Bay and West Bay progress. And as you can see, our total phase 1A population is 22,000 people that need to be vaccinated. This is across the East Bay and the West Bay. Of note, I wanted to bring to your attention the two red circles. So in order to receive an invitation for the vaccine, you have to have an active MyChart account. And we would really, and as you can see, there's a couple of thousand people that do not have that, as well as once you receive an invitation, once you have a MyChart account, you'll receive an invitation. And you can see that there's quite a few people who haven't received the invitation. So I'm going to spend just a couple of minutes now to help people understand, since this is a new process and very different from the flu clinics, what you need to do, because we're very committed to vaccinating everybody in group 1A that wants a vaccine. So first, in activating the MyChart, you will receive an email, or you should have received an email from this email address, and you will get a code to activate an account. You can do one of two things. You can click this link here and put in the code, and you can set up your MyChart account, or we have help, and there's a MyChart help center, and you can call there. If you feel like you didn't receive this email, or you don't know if you have a MyChart account, please just call the MyChart help center and they will help you set one up. Secondly, scheduling an appointment. I'll just take a minute here because it is a little bit of a process. So first of all, once you have a MyChart account, you will receive a message that will look like this. It'll be the employee COVID vaccine offer. Some people think this is the title. It's actually where you have to click. So you click here in order to get into the offer. There is quite a long list of frequently asked questions, and we really want people to be aware, because this is a new vaccine, of all of the issues that you might have questions about. It is about 20 questions, and you have to scroll to the bottom and accept that you've read these, and which means that you are accepting that you consent to receive the vaccine. Then the next process is for you to make an appointment. Once you've done that, in your MyChart, this will show make an appointment. Now, it doesn't say it's particularly for COVID, so you do want to click on that, but it will be something new in your MyChart account. Once you do that, you'll be able to get into a scheduling section here, and you can pick a time. Now, unfortunately, people are asking whether they can choose where to go. We can't do that now due to sort of the logistics around some of the vaccine supply. So you will be assigned to a site. And we recognize that people who work at Parnassus have to go to Mission Bay or vice versa, that sometimes that can feel like a burden, but we really appreciate your support because this is the way that we have to set this up for now due to vaccine supply and also the difficulties of running two different vaccines at one center. Once you do that, there's one last step you have to do, and that is that you have to click here for schedule, and then you will be scheduled into your time. And then real quickly, I just want you to, some people are very concerned that if they weren't here or they missed the opportunity, we are sending more invites out. So for everyone who hasn't acted on their invite, we will re-ping you. We're sorry if that feels burdensome to you, but we really want to make sure that people have the opportunity. And you would click here in your message, request the appointment, submit, and then you go through the same process you did before. You won't necessarily make an appointment from this step. In a day, you'll get a new invite. So thank you for bearing with us with this process, but it has really been helpful to have self-scheduling. This is our capacity. Before the black line was when we opened the Parnassus site. And as you can see with the Parnassus and Mission Bay site, we've dramatically improved our capacity. These are our projections on when we plan to have everyone in 1A and then 1A through D complete with second dose. So second doses started for 1A a couple of days ago, and we plan to complete that by the last week of January. And then for everyone else, we planned, if everyone accepts the vaccine, by the first week of February. Okay, and now I'll turn it over to Desi Kotis, our Chief Pharmacy Executive, to talk about our vaccine supply.
Thank you, Gina, and good afternoon, everyone. So I know there's a lot of lines on this slide and a lot of detail. We are tracking our supply. We have both the Pfizer and Moderna vaccine, as most of you know, and we're inventorying not only in every vial, but every dose, almost as if, or I should say exactly as if it was a controlled substance drug. So you could see here, as Gina stated, we started receiving vaccine the day we started vaccinating on the 16th. The total doses that we've received at the top, over 17,850 doses, and what we've administered. So this is what we've administered, almost 70% of our first dose supply. The one thing that's not here, it might seem like, well, why are we holding 30%, Desi? Well, we're not. We're holding that for those who have appointments. So we are real close to just days on hand, just in time supply. And then for second doses, you can see here, if you go to 12/22, 7,900 Moderna first doses were supplied and allocated. And then if you go to next week, you'll see that 7,900 Moderna second doses on January 12th will be allocated. We've been very fortunate, and I'm very confident that the second dose supplies are coming in line with what we've received for first doses. So I will stop there and answer questions later. Thanks. Oh, and I'm turning it over to Dr. Susan Smith. Susan?
Sure. Thanks, Desi, and thanks for the opportunity to talk about the complex topic of phasing, which I'm going to try to simplify. Nationally, this has been a much talked about conversation, and in California, it has been as well. This week, the California Department of Public Health updated their website with this phasing that is here. We are in the process of completing phase 1A, which I think most people know by now is the people who are face-to-face in contact with high-risk situations for COVID. So everybody in this group is on site, and they all have some interaction with COVID. We started with those people who are most likely to be exposed to COVID, and are completing those people who are less likely but still possibly exposed to COVID. Phase 1B is what we'll focus on a bit more today, and the Department of Public Health this week divided that into 2 tiers. And then phase 1C, we aren't quite ready for yet. Let me see the next slide. So the order which we're going to proceed into phase 1B is what I'll talk about. Sam covered this, but I'll just go into a little bit more detail. So the first part of that phase will be the on-site workers, so UCSF employees and learners whose responsibilities have required them over the past 10 months to be on-site regularly. And that includes everybody in research, educational, operational, and administrative roles. So these people have not had contact with any specific risks about COVID, but they have been coming into work, and they need to come into work in order to continue their jobs. Next slide. The next round after that will be to all UCSF workers who are remote, currently doing fine working remotely, but may have other risk factors, specifically those who are age 75 and above, and they will come in and then as soon as we can get through that next that top tier in 1B, and we are working on what will be our approach for all others who've been working remotely, and we'll share information as soon as we possibly can. Next slide. And then we're also simultaneously and concurrently going to try to start our patient vaccine process. We have lots to decide and work on about exactly how we're going to do that. We know that we will be following the Public Health Agency's guidelines to prioritize by age, starting with those 75 and older, and then the 64 to 75-year-olds, and then the ages below that, and then risk factors as they become applicable. The one thing I want to make sure to emphasize here for all the people in the clinics and the patients who might be tuned in is that you will not need to contact UCSF in order to get your vaccine. We will be outreaching and contacting our patients when they become available, when the vaccines become available. Our staff in the clinics won't be responsible for putting in orders. It doesn't help to specifically get on a list there. We will manage it and we will outreach. And of course, we'll be dealing with problems and things that are missed. Next slide. And then lastly, I'm just going to go over the schedule of when the various vaccine centers are open. You can see that it's open 7 a.m. to 7:30 at the Parnassus and Mission Bay sites every day. And we're aiming to get to 1,400 vaccines daily there, assuming we have sufficient vaccine supply. The East Bay on the next slide is not, is closed on the weekends, and they are open 7 to noon and 1 to 4:30, and they vary by dose and by day. They have some smaller needs and smaller doses available to them. Okay, I think that's all. I want to thank all of my team who's been working just incredibly hard to get this done, and all of the enthusiasm that we see in the vaccination centers. It's my pleasure next to introduce Dr. Ralph Gonzalez, who is the Associate Dean of Clinical Innovation and Chief Clinical Innovation Officer at UCSF, and he will be talking about new cases and testing.
All right, hello everyone. Let me pull up my screen. Let me leave that. Sorry, I was having a phone as a backup and I'm still getting an echo, so hopefully that went away. So good afternoon. I will give you a COVID-19 testing and case update for the new year. So this slide shows our testing progress over the past year now. If you look at total employee testing volume on the bottom in the graph, you can see that in the blue is our clinical lab testing, and in the orange, over the last month in December, we've really seen a big bump and spike in our testing volume due to our Color partnership. And so that's really good. We get asked regularly about our positivity rates, and so I thought I'd show those for you today. Here you can see that if you look at the clinical lab on the left at the top, our overall positivity rate is 4.8%, with asymptomatic rate at 1.4% and symptomatic rate at 6%. And then I'll jump over here to the far right, which shows you our Color testing volume. And here you can see we've had, just in the last month, we've had over 7,000 unique employees tested for a total of 12,000 tests so far. And our overall positivity rate here is 0.6%. And we regularly get asked about why the rates are different for Color versus our clinical lab. And the main reason is that we still send medium and high risk exposures and high risk asymptomatic patients, for example, with household exposures, to our clinical lab for testing. And so that's why the rates are lower on the Color side and more normal or a little bit higher on the clinical lab side. If you look at our positive case distribution on the left, this comes off of our public dashboard. You can see in December, it was quite a large case volume that month. The distribution, as you can see, is roughly equivalent to previous months. It's just bigger numbers for each group of students, UCSF Health Clinical, Research, and Admin. And unfortunately, January has just taken off with big numbers. This is just the first 5 or 6 days, as you can see here in January. The contact tracing team, God bless them, have been really busy. They've completed in December the case determination and source classification for 181 cases that I'm showing you here, just to give you a sense that the distribution is roughly similar to what we've seen in the past. Roughly 2/3 are from the community or household contacts, and the rest are likely occupationally acquired. Again, this designation happens when there's not a clear household or community contact, but people work in direct patient care, then they get classified as direct patient care. In cases where employees have worked with COVID positive patients, that's in gray. Coworker to coworker is still happening in orange, and then indirect patient care in purple. I wanted to show you a little bit of our results from our color and asymptomatic testing. Here in the graph, you can see each week our volumes have gone up. This past week, we exceeded 1,000 tests on Monday, and we continue with high rates of testing this week. And I believe that part of that is due to people complying with the return to work testing after travel. Thank you for that. And I'll show you some more numbers in a second. Our median turnaround time continues to be quite good at 18 hours. And here the positive rate of 0.35% reflects all the tests with all the employees. And so in this case, it looks lower because we're counting repeated tests with each individual. Whereas before I was only showing you unique individuals. If we look at our color, just at the 40 positive cases we've gotten through asymptomatic testing, they seem to be equally distributed across contact tracing, possible exposure, travel in green, and then referred in orange. And so over 1,000 people returned to work who reported travel on their Conversa screener, and this shows you where they traveled. Roughly half were domestic travel inside California, but outside the San Francisco 10-county Bay Area, including Santa Cruz. Domestic travel outside of California, and then a very small fraction international travel. I believe this number could be much higher in a typical year, and so thank you to those who tried to stay home as much as possible. We did this week, because of the new strains that have been reported and identified in California, we decided to tighten up our testing policy for people returning from travel. And so this week we started asking people for 3 tests, testing on day 1, after return from travel on day 3 to 4, and then a 3rd test between days 7 and 9. And to make that more convenient, we're allowing people to pick up all 3 test kits on their first visit to our test centers. And then they don't have to come back for the 2nd and 3rd test. They can just reactivate each time and drop it off at the test site, at the drop box. So I just want to make a shout out again to all the people from HICS to frontline staff and to the OHS contact tracing team. They've been working now through 3 straight holidays, 24/7, and have just been doing an amazing job. I do think that we will round the corner. That's why I put this up here. I think it's coming soon, and we just got to hang in there for a little bit more time. Again, what can everyone on this call or on this Zoom do to help get us there sooner is just to remember the fundamentals. And we have to keep in mind that most COVID transmission is preventable. It's not, it doesn't have to happen. And if we use our eye shields, our face mask, and our hand washing, and try to limit exposures or these types of activities, that hopefully we can turn that corner real soon. So with that, I'll stop. And I don't know if George is with us or if we're going to Lisa next.
George is with us. Let's go to George Rutherford.
Okay, George Rutherford.
Hey,
Needs no introduction.
thanks, Ralph. Okay, let me share my screen. It's a pleasure to see everyone today, and Happy New Year. So in the United States, things are going slightly better. We've had 21.5 million cases and 280,000. We're well over 200,000 cases a day here, running fairly constantly. Hawaii is the only state not surging or recovering from a surge, and cases are all over the place. But with many in the Southwest, in Arizona, Southern California, a little bit into New Mexico and Southern Nevada, but also across the mid-South. And when people start saying how bad California is doing, we're number 38 per capita in total deaths and number 31 per capita in total cases. Unfortunately, nationally, this is running at a very high level, with 365,495 total deaths and 4,112 on January 7th. Now, just to put that into perspective, COVID-19 became the leading cause of death in the United States in December. And on 7 days in December, there were more deaths in the US from COVID-19 than there were from cardiovascular disease and cancer combined. This table here from JAMA shows the age-specific mortality rates from March to October before this last surge. And you can see in over 85-year-olds, it's second only to heart disease. And then as you go down, you can see it's really right here squarely as the third leading cause of death, which we've now passed. This was through October. You can see the cases here in the sort of kind of Midwest, Mid-South, and then here in the Southwest. And in California, we've had almost 2.6 million total cases. We're running at a clip of about 40,000 cases a day. We've had 28,599 total deaths and 486 on January 7th. Deaths are going up because it's reflecting this part of the curve. I think that this is kind of a real sort of plateauing, and it's a combination of the post-Thanksgiving, post-Christmas, post-New Year's surge, plus in some places, plus a real decline in others. And you can see here the 5 most impacted counties in terms of total numbers. Los Angeles is probably still going up. San Diego, Riverside may be flattening out. San Bernardino is clearly coming down, and Orange County seems to be coming down as well. This is a slide that Sarah Coven made, who works with my group and for bibliography and stuff. Here, blue are all other counties, and orange is Los Angeles. So there are more cases in Los Angeles per week than there are in the rest of California combined. You can see, well, the rest of the California may be starting to show some decline. It's been relatively flat in Los Angeles. Again, these trends in case numbers are very dicey to interpret because of delays in reporting over the New Year's and Christmas holidays. Here in the Bay Area, we're sort of flat, sort of maybe going. It's a little unclear exactly what's going on. The good thing is that the R sub E's, the effective reproductive numbers, have fallen considerably since the last time I talked with you. And at least in a couple of places, as well as statewide, the effective reproductive number is under 1. In terms of tiers, we're far, far, far away from the 7 cases per 100,000 per day needed to move from the purple to the red tier. And you can see in many counties, cases are increasing, including San Francisco. This is all of concern because it's triggered hospitalization increases, with more than 20,000 people being hospitalized with COVID statewide, and more than 2,000 in the Bay Area, with ICU admissions for ICU days for COVID, the highest they've ever been. California is currently at 74.1 cases per 100,000 per day, 10 times more than you would need to get to the other tier. We're having 15% of cases of tests done were positive, which is huge. Overall, the ICU capacity, this is licensed beds with some additional metrics put into them, but given the state's metrics, this is at 0. The effective reproductive number, however, is under 1 at 0.97. And again, for those of you who are aficionados of California geography, Humboldt, Sierra, Alpine, Mariposa. And then this deepest purple tier with the different regions, basically everybody's are in these different in these things except the far northern tier of counties that have managed to stay above the 15% threshold of ICU availability. Bay Area, we're down at 3% today. Now, changing subjects, in the United Kingdom, they were doing pretty well, had gone through a kind of a tough lockdown here in November, started to see cases fall in December, and then they've gone through the roof. Now, a lot of it, this is on Regent Street in London on the Saturday before Thanksgiving. No mask, no mask, no mask, you know, mask, that's good. But a lot of no masks, right? And so everybody says, oh, it's just because they're not, you know, there's too much social interaction, no mask. But it's more complicated than that, because there's a new mutation that started to spread rapidly in Greater London and Southeastern England. This has accumulated a lot of different mutations, 14 of which are structural. This is accounting for more than 20% of the new infections in Southeastern England in November. And the thought is that this binds more efficiently to ACE2 receptors. And as a result, it has a higher effective reproductive number that's about 40% higher than it is in overall. Okay. There is, however, this is the good news, no evidence of more severe disease, no evidence of resistance to the vaccine-derived antibodies, no evidence that it cannot be detected by PCR, and no evidence of resistance to monoclonal antibodies. So that's good news. And here you can see, these changes in lineages are common. This is looking at in Britain since January of 2020. And you can see these different lineages that kind of come and go. This is the dominant one now. And it's now starting to be, it's been replaced by a European lineage. Here's the new one that seems to be much more transmissible, about 40% more transmissible. Okay, so that's starting, you're starting to see that emerge. Is it here in the United States? Yes. There have been, I think it's 59. I may have done the math wrong here. 26 of them are in California. 24 of these 26 are in San Diego County. 2 are at Big Bear in San Bernardino County in a couple. The ones in San Diego are from 19 different households that don't seem to be particularly related. There's also no clear link to overseas travel or to any of these other cases. That would all, I'm 50, well, there are a few more. That would all suggest that there is much wider spread transmission of this variant than we're detecting right now. So this is very much of an evolving story. So the question is this more virulent? There's no evidence, plus one mutation on it is a fact associated with milder disease. Can it evade antibody-mediated immune responses? Unlikely due to the diversity of neutralizing antibody epitopes. Is it more transmissible? I think the answer is probably. Mathematical modeling would certainly say it grew much more rapidly. There was an increase in the R value, and there's increased viral load. So I think the answer to that is that yes, it's probably more transmissible. Yes, it's in California. Yes, it's probably spreading, and we'll have to kind of wait and see. There's another variant in South Africa that apparently has been associated with more disease, more virulent disease, which has not been detected here in the US yet. So I will stop there. And since I missed the warm-ups, I don't know what I'm supposed to do now, Lisa. So please help me out.
Thanks, George. I'll take it over from here. Let's go to the questions. So this one is for Josh Adler. Josh, will UCSF be adopting the single vaccine to vaccinate more people over the double vaccine shot?
Yeah, the short answer is no, not right now. We are continuing to use the two vaccines as recommended by both manufacturers and all US-based regulators and officials. If that were to change, we're certainly open to it, but for now, we're sticking with the original plan.
Great. This one's to the vaccination team. Just to clarify, when do you expect to have everyone vaccinated? Is that by mid-February? And does that include remote workers?
So this is Susan. The February date was phase 1A, so the people who have exposure to COVID on some level. All of UCSF is really much harder to predict at this point because we don't know the supply of vaccine and exactly how quickly we'll be able to get vaccine into arms. We are trying to increase the rate at which we're providing vaccine, and I can't give a firm answer, I think, at this point about when.
Okay, thanks. After having COVID, should we wait to get the vaccine? How long should we wait to get the vaccine is the question.
I think the original recommendation, and I don't know that it's changed, is that you should wait 3 months after having had COVID before you obtain the vaccine.
Okay, great. This one's to Josh. Once vaccinated, are there any changes to travel restrictions, return testing, completing the daily screeners?
The other answer, I'm gonna give the same answer to the other question. The answer is no. And I want to just spend a second on why that is. Although we are quite certain that the vaccine is very effective, 94 to 95% protection and perhaps even greater protection against severe disease, there are still some things we don't know. So one is it possible to be vaccinated and still transmit the disease? Maybe. And second is, we don't know how long vaccine protection lasts. And so for those reasons, one can expect at least for the next few and probably several months that all of those procedures that have protected us so well so far should continue even if you've been vaccinated.
Great, thanks. Again, to the vaccination team, will employees that are high risk due to other illnesses be vaccinated with the 75 and older group?
I can take that one, Susan, if you want. So we will be following the guidelines. So right now it's just everyone over 75. The next tier of 1B incorporates people who have comorbid conditions. UCSF as an employer will not be embarking on determining comorbid conditions for their employees, but as a patient, you will have access to vaccine like other patients through as a patient through your provider.
Great. We have several questions from folks wanting to know how they can help with the vaccination efforts. Where do they sign up to volunteer? How can they support your team? Is it possible for those without clinical training to volunteer?
Yeah, so that's a great question, and we really appreciate it. In fact, the bulk of the vaccine clinic thus far has been run with our UCSF family of volunteers. I can make the volunteer website available where you can go in and sign up for shifts. Most of the volunteer shifts do not require that you have a clinical background.
Excellent. This one's for George. George, do we know how the variant is affecting children? You're on mute, George.
You're right. There in the British report, it said it was more common in people under 20. And it doesn't really give much more detail than that. The concern is that it might get into more elementary school ages, but there's really, it just hasn't been sorted out yet.
Okay. This one's for Ralph. Ralph, can you please explain the definitions for positivity rates for our lab testing, especially the symptomatic versus asymptomatic?
Yeah, so the asymptomatic testing is, and this is now in an order set in Apex, so the providers when they order testing can help us distinguish symptomatic from asymptomatic. Asymptomatic refers to people without symptoms referred for testing who have high-risk exposures or household contacts that are positive. And so we want the highest sensitivity test possible, and that's our clinical lab. So we continue to send those patients to the clinical lab instead of referring them to color. And if you go through our portals, you'll see that if you have an unprotected exposure to a COVID confirmed case, we send you to the hotline and ask you not to use color. In terms of symptomatic, it's basically the people who have symptoms that come in. And that gets identified in the hotline, but also if the provider's ordering it, they can put it in there. The one other point I'll make is that in the first slide I showed you, the denominator there was the total number of the unique number of employees tested, because people get tested over and over again for asymptomatic testing. And so if you hold the denominator fixed, then that's where you get an asymptomatic test positive rate of 0.6%. But the other way to do it, which was in a later slide, is if you just take the same number of total cases, but divided by all the testing that was done, the total volume, then you get a lower asymptomatic testing rate of 0.35.
Great, thanks. This one's for the vaccination team. If we get our vaccination elsewhere at another hospital or at Kaiser, how can we let UCSF know?
Yeah, the best way to do that would be to email the COVID vaccine at ucsf.edu with your name, your employee ID, ideally, when you got the vaccine and what type. And then the other issue is we are going to try to connect with the CARES database to be able to pull that data into Epic, into the record.
You can also decline our invitation, which we would encourage you to do so that we don't go chasing to try to get you to come in and be vaccinated.
Okay. Also to the vaccination team or to Josh, is UCSF going to work with community partners with whom we have worked on testing, such as the Mission and the Bayview?
Sure, I can. Yes, well, we are in discussions through the Hospital Council with our local partners, as well as the Department of Public Health, with the general notion in mind of mass vaccination options for at least San Francisco. And so those discussions are beginning. And at the same time those are happening, I want to assure everyone we are continuing to focus on maximizing our vaccine throughput right here at UCSF.
Great. This one is perhaps for Dan. Are there research studies that folks can sign up for having received vaccine while pregnant, or any breastfeeding, or any other research studies about the vaccine?
Well, there are a host of studies going on, including, as many people know, the CHART study. But let's get back to folks as to the best way to access what's out there, because there are so many that are underway.
Okay. This one's for Ralph. What's the false positive rate with color testing?
It's extremely low. The specificity, which is how you calculate the false positive rate, is greater than 99%. It's very similar to PCR.
Okay. Lots of questions about patients and where they fit into the vaccination program. First off, how many patients are projected to be vaccinated?
We're still working on some of those numbers and decisions about exactly how and who to vaccinate first. We'll certainly start with those over 75, and we will do our best to include all UCSF patients who've been seen over some period of time that we still need to make some final decisions about. So I think it's a preliminary to give a number at this point.
Okay. Here's a question. After receiving both doses, will I be able to interact with members of my family that I've been staying away from?
Yeah, this is George. Yeah, I would absolutely, if you've been vaccinated, you've been vaccinated. Workplaces are another thing, but I think as long as people are vaccinated, they're vaccinated, and they can go and do what they need to do at their homes. Now, if you go outside, that's another issue. We might have to be a little bit more careful there until we get enough people vaccinated. But I think in your house, it's going to be okay.
Okay. We've heard this question a couple of times, but it bears repeating. If an employee declines the vaccine invitation, then changes their mind later, how do we communicate a reversal of this decision?
Yeah, so every employee at UCSF that wants a vaccine in 1A at this point will be offered a vaccine. And as we move through the other phases, we're committed to vaccinating all of our employees who want it. The specifics on how you re-sign up the best way, and I do want to apologize. I know sometimes it takes a little bit for us to get back to you on the COVID vaccine at ucsf.edu. But the best way is to email, and we can take you through the steps, but you do not lose your phasing, and we will help you get vaccinated if you change your mind and you want to accept the vaccine now.
Great. Question about those who help volunteer for the vaccination. Will they receive a vaccine?
We have made the decision that if you are a vaccinator, and we encourage people to sign up for at least 3 shifts because we need to do some training and it's hard to train everybody fresh every time. But if you come and come be a vaccinator, then you are classified as 1B. So you would be in the phase that we would put you in line now to get a vaccine.
Excellent. This one's for George. If the viral load for the new variant is higher, shouldn't this imply more severe disease given current theories?
Yeah, it's a theory that it's higher. Their viral load is a risk factor for disease progression. It's also a risk factor for transmission. I don't think anybody's worked any of that out yet.
Okay. Let's see. Okay. Is there any advice for folks who already know they have allergies to shellfish and on getting the vaccine safely? What is UCSF doing to safeguard those who have allergic reactions?
So we ask those who have allergic reactions to be in contact with occupational health as part of the process to consenting to an immunization. What we can also say is that shellfish and very common allergic reactions do not predict an allergic reaction to this vaccine. And there are some very specific things that do predict it. And it looks like Desi wants to make a comment as well. Oh, no, she doesn't.
Okay, last question before I go to Mark Larrett. Are there any incidences of people testing positive for COVID after the first dose of vaccine, but before the second?
The initial data, yes, there may well have been people who were exposed just before getting the vaccine. So they get the vaccine and then within several days can turn positive before they get the second vaccine. The data kicks in with the vaccine being effective around 10 days after the first dose, and then accelerates directly from there. Anybody else have something to add on that?
Actually, I want to ask a clarifying question to both Susan and George. So if you've been vaccinated fully and you're working in a high-risk environment, what's the danger of transmitting the virus when you go home? I know you've been asked that question already, George, but is there any evidence that you may be able to transmit, a very recent exposure earlier in the day when you get home?
We just don't know the answer to the question, Dan. I thought I was answering a different question, but we don't know whether, as Josh said earlier, we don't know with the Pfizer vaccine specifically, whether the vaccination is associated with decreased transmission or not. I think it probably is. We're talking about, we're putting together studies now to figure that out directly. But for right now, there are no data on that. There were some very preliminary data from the Moderna vaccine that suggested some effect. But again, they were very preliminary, very small numbers, and probably not enough to bank on. I think we have to wait and really figure this out in real prospectively.
Okay, thank you very much. And now we'll go to Mark Larrett, President and CEO of UCSF Health. Mark.
Thank you, Lisa, and thanks everybody. Happy New Year to you all as well. I was just reflecting on Chancellor Hobgood's remarks at the beginning when he mentioned the 2 UCSF employees who have passed away as a result of COVID. And it brings home this scourge that has ravaged our country, continues to ravage our country. Sometimes these, I remember early on in the COVID where people were saying, have you ever heard of anybody who has it? Well, I think now we're well past that. And now we're into the phase of, do you know people who've died of it? So this is so serious. It's affecting our nation, obviously the world, the nation, our state, our communities, and our individual families. So it is so important for us to remain focused on doing everything we can to manage it. As Ralph Gonzalez says, this is mostly a preventable disease, and we all need to take our steps to prevent that. Just a couple of comments on vaccine. I've spent a fair amount of time working with the state and with the city and county of San Francisco, and everybody's kind of learning this on the fly. The governor pointed out a day or two ago that there are 1 million vaccines in freezers in California right now, not in arms. And he has challenged all the providers in the state to get those 1 million doses into arms by next Wednesday. We'll see how that goes. But it points out that we haven't been able to rely on an existing infrastructure to take care of everyone in the state. Some of the questions that people have asked also highlight that. What about the essential workers who are in different industries, people who don't have a medical home, people who otherwise don't know exactly where or how they might get a vaccine? Those issues are being discussed, but there isn't an obvious answer to it. I will tell you that the hospitals in San Francisco, working with Grant Colfax, the director of health in San Francisco, have talked about trying to get to 15,000 doses a day, maybe collaboratively taking over the Cow Palace parking lot, having drive-through vaccination. That's the kind of place we need to get to in order to really have an impact on this terrible disease. All these roads go back to vaccine supply. And I hear different statements about how much supply there is, but I am very heartened by President-elect Biden's commitment to take the stockpile that has been reserved for the second doses and just get that into arms now, hoping that Moderna, Pfizer, and hopefully at some point other vaccines, that those manufacturers will be able to supply the second doses in a timely fashion. But I think the pressure is on for us to figure out how to build an infrastructure so that everyone can get vaccinated in a timely way. I'll just end by saying that I get a lot of calls, a lot of emails from very anxious patients with serious comorbidities, people who are so eager and desperate to get the vaccine. I would love more than anything to be able to say, yes, come on in and we'll take care of you. But we are, as you have heard, been working very diligently to follow the letter of the law and the intention of the early guidance that we've received from the state, from the federal government on how to prioritize vaccine. And we're sticking with that. We're very values driven here at UCSF, and we will continue to be that way. But I will also say that it is our most fervent hope that we can get everyone vaccinated as soon as possible. So if the vaccine flows quickly, if we can build that infrastructure, and if we can convince more and more people that getting vaccinated is the surest way for us to blunt the growth of COVID-19 and get ourselves back to normal, that is really the answer for us. As I was thinking about Chancellor Hoggood talking about the events of this week, it felt like 2020 and all the misery that we experienced that year has bled over into 2021. But it does feel to me like that with the work of the tremendous efforts of the team that you've heard from today, with the commitment of so many people to address this COVID scourge, and with all of your efforts to do the things that you can be doing, wear a mask, wash your hands, keep your distance, that maybe 2021 will get back on its proper track. And maybe by the middle of this year, maybe by the end of this summer, we'll be back to someplace closer to normal. That's my fondest hope. And I just wish you all good health in this time. Please be careful, take care of yourselves, and take care of your families.